Turning maybe to some of the more general points that I was wanting to make about the government's position on mental health. We have made suicide prevention and mental health a priority, especially for young people. Many of the issues raised today are symptomatic of an NHS that is broken. Looking at the figures, the challenges that face the NHS truly are sobering. Around 50% of lifetime mental health conditions are established by the time an individual is aged 14 and 75% by the age of 24. Evidence suggests the prevalence of mental health conditions is rising among children and young people. In 2023, 20.3% of all 8 to 16-year-olds had a probable disorder compared to 12.5% in 2017. The COVID-19 pandemic has, of course, exacerbated needs, with analysis showing that 1.5 million children and young people under the age of 18 could need new or increased mental health support following the COVID-19 pandemic. According to the Darcy review, some 343,000 referrals for children and young people under the age of 18 are waiting for mental health services, including around 109,000 referrals waiting for more than a year. Within NHS Cheshire and Merseyside ICB, as of the end of September 2024, 10% of children and young people still waiting for first contact with NHS-funded MH services had been waiting more than 951 days, equating to 1,301 people. Half of those still waiting had been waiting for more than 300 days. There are 13,010 children and young people still waiting for first contact with NHS-funded mental health services. Until recently, there's been an upward trend in suicide rates for children and young people. In women between the ages of 10 and 24, the rate has nearly doubled since 2012, rising from 1.6 per 100,000 to 3.1 per 100,000 in 2023. I will give way.
I thank the Minister for giving way. Over the last 10 years, one student has died in England and Wales every 4 days as a result of suicide. And yet, despite this forlorn tragedy, the law remains very unclear in relation to what duties and responsibilities universities have in relation to their often very vulnerable young students. So would the Minister meet with me and members of the Learn Network and For the 100 to discuss the introduction of a statutory duty of care on all higher education providers?
I thank the Honourable Lady for that very important intervention, and of course I'd be happy to meet with her and the Learn Network. The government can't do all of this alone. We need to work in partnership with all sorts of different stakeholders, including universities and the higher education sector, and so absolutely we would support any partnership working that we can do.